Hi, Lisandra. How are you?
Doing well. How are you? Thank you so much for joining me. I'm very, very excited to get the chance to speak with you. I live in Atlanta and I know you represent us here in Georgia. So I'm super excited that you are one of the people that's representing us, especially when it comes to healthcare in this country. I work in comedy and I do a lot of political satire. So I keep up with politics. And I know that a lot of people that follow me have kids, they have jobs, they're not keeping up with the details of what's happening in Washington to the same degree that I would, and definitely not the same degree that you do. So the messaging that's coming out of the White House is extremely important because that's what they're getting mostly. And it's very dangerous because the messaging right now is Democrats want illegals to have free healthcare, which is a lie. But so for the people that follow me that might only have a couple of seconds to understand what's really going on, could you, in your words, and to speak to a regular American, what's actually happening?
Well, the fact that they are lying, and indeed they are lying, tells you everything you need to know about the strength of their argument. We are trying to extend health care to hardworking Georgians who, even as I speak, are opening up the portal Georgia Access if they're on the marketplace, and they're literally seeing that their health care premiums have been doubled, tripled, in some cases quadrupled. I'm not telling you something I've heard, I'm telling you something I know because I am literally talking to ordinary Georgians every day who are telling me their stories. I talked just a little while ago, literally a few minutes ago, to a retired school librarian who, after 40 years of working and 40 years of marriage, he and his wife were looking forward to their retirement. He opened up the portal in the last couple of days, and his costs went up from $441 a month to cover just him on the lowest cost plan he could find. He said he's a pretty healthy guy. Is now well over $1,100 a month. That's what this fight is about. It's about you. And the fact that Republicans are lying to steal your health care, the fact that they would shut the whole government down to keep you from getting affordable health care tells you everything you need to know.
Yeah, and even Marjorie Taylor Greene is agreeing with us now. So wild.
She checked it out, and her own children, she
Yeah.
said,
But
are in this struggle. So these aren't Democratic talking points. These are the lives of ordinary Georgians, many of whom, by the way, are Republicans. It is the red districts that are being disproportionately impacted by this. If we were looking at this honestly in just sheer political terms, we might just let the Republicans stew in the mess that they've created because that's going to come to bite them next fall.
yeah.
But I'm not thinking about the politics. There'll be plenty of time for that. People need their health care, and that's what this is about.
I'd love to get your thoughts on this. I'm the workforce. Healthcare has historically been tied to employment, and employment has changed a lot over the course of our country. And there's a lot more people like myself that are freelancers that work in the digital workforce, and we're not getting support from our employers like people traditionally did. People that drive for Uber or again 1099 employees. There's a lot more of us now. Um, is with if the ACA changes, a lot of us will not be able to afford healthcare, much like you said. Do you see a world where healthcare could not be tied to employment, or is that why we have these subsidies? So then people, it's not tied to employment.
Well, I talked a couple of days ago to a small business owner in Georgia, and she actually lost her job. You talk about the uncertainty of labor and employment sometimes. She lost her job during COVID, and she started her own business. She always liked to cook, and she managed to flip that into a business that she's been growing over the last 5 years. And this woman who had always struggled to be able to afford health care because of the ACA subsidies, she was finally able to afford health care, which was critically important to her because she has a son, a minor child, who has type 1 diabetes. And so she's started her own business. She's now able to afford health care, which is absolutely necessary because of her son. And then the one big ugly bill happens. And she checked, and her health care is now unaffordable. She's going to have to close her business, which she's doing right now, and try to find a job that hopefully has health care. So you raise a very valid question. These are issues that I think about all the time. I think that health care is a human right. It's certainly something that the wealthiest nation on the planet can and ought to provide for its citizens. People ought to have a path to getting basic health care, working
Absolutely.
people. And I'm open to thinking about how we get there.
Oh, I think that also, well, people are like, just go get a job, right? But the ADP report for September says that we are down 32,000 private sector jobs. So I know that a lot of my friends have been on the search for jobs, and the job market is really tough. So it's not really as simple as being able to just like go get a job with healthcare nowadays.
Question that our healthcare system is broken. It's broken, and it needs to be a lot better than it is. But what the Republicans have done, literally in the last few months, is to take a broken system, and they're about to smash it into little pieces, and those pieces are literally the people who are down there trying to figure out how they are going to get health care. If were it not for the one big ugly bill, this small business owner that I'm talking about, she would have health care. She'd be able to afford health care. So in some cases, these are small business owners. In other cases, these are people who work a normal wage job. They're not poor enough for Medicaid. They can't quite afford the marketplace insurance. And so they need these ACA subsidies. We ought to restore the ACA subsidies and then build on that and see how we can make a system that is broken in many ways, but was still serving a lot more people than we have served in previous years. We can build on that, but right now we need to extend these ACA subsidies.
Okay. And so I know before we wrap up, I know that you are someone that's very positive and likes to spread message of hope, and I as a comedian like to spread joy. So I know that we're living through some tough times. But is there a message that you can give to people to kind of like get them through this? I know everything passes, but like, my goodness, we need a little bit of positivity. So is there anything that you want to say to people as we go through this like time in human history?
No, listen, I'm not going to sugarcoat it. These are tough times. There's no question about it. I'll tell you that one source of joy for me these days are my two small children. I look into their eyes and I wonder how in the world did I get so lucky. I've got an incredible 9-year-old daughter, 6-year-old son. And, every now and then they get into it. They're very close, but there's a sibling rivalry and they all have their little argument. And what's so cute and amazing to me about children is literally 15 minutes later, they don't remember that they had to fight. I think Democrats and Republicans can learn from that. And let's get over our partisan differences, center the people. Don't take yourself too seriously, which comedians help us to do. And let's figure out how to get the people some health care.
Amazing. And then before my last question for you, it's very serious. What's your breakfast order?
My breakfast order.
Yeah. What do you get? If you have your choice for what you have for breakfast, are you sweet or are you savory? Come on.
More savory than sweet.
Okay. What do you get?
You
Eggs?
need more detail?
Yeah. People need to know.
Some eggs, if I'm doing right, I'm doing the egg whites, some salmon, maybe in a scramble or an omelet, spinach, salmon, omelet, and a cup of tea.
Look at that, Senator Warnock, everybody. Thank you so much for your time.
Thanks.
And again, thank you again. Have a wonderful day.
Keep the faith.
Yeah, and thank you for all you do.